Karnataka state branch, we are going to start one more important, the new topic, as we are doing every month one program. So in that way, we are doing this month a webinar. The important topic of webinar is, it is for the younger generation, especially the graduates, those who are completed the graduate MBBS. They have got a lot of difficulty, lot of embarrassing situation in such a way that what to do. Some people, they go for the post graduation. Some people, they go for abroad. Some people, they want to choose a something like a IAS course. So there are different confusion will be there. So let us have a clearance and have a vision with our own and friendly and master of the coach. As everybody knows that the sir is a father of the Bhatia coaching center, which has spread all over India, including Delhi, Bombay, in even Bangalore also. There are many coaching centers in the name of Bhatia, and we have also gone through the Bhatia coaching. Many of the tips as well as the textbooks which we have read, I've gone through, and we were just reading. So who was Bhatia? We don't know. So now we are coming to the main person. The sir is there, and he has accepted. Sir has met me recently in the Bombay in the Junior Doctor Network conference, and happily agreed. And also now with that makeup, we are going to have this program. So thank you, sir, for accepting this program. Dr. Mukesh Bhatia, sir. Welcome to the program, sir. And I heartily welcome the KSP president, IMA KSP president, Dr. Virabhadra, sir, who is always encouraging and also always telling you go ahead and we'll be there, we'll support you. And also with his support, we are going to start the newer this conference, that is JDN conference, shortly within a few 2, 3 or 3 months. Here, whatever the decision we are taking in the committee, we'll do shortly. Thank you, sir, for giving an opportunity, sir. Virabhadra, sir. And also, I must welcome Dr. Surya Raju, sir, who is the Honorary Secretary of IMA KSB, for giving us opportunity to conduct such a important program. And also, I welcome all the members of the IMA KSB who have joined. And also, I welcome all the junior doctors group, including the internees, PGs, and all the faculties who have joined. And also, many members will be viewing in the YouTube. I also welcome everybody to have a opinion and also give some remarks and also have a discussion. Good discussion will be there. This is an important topic which evergreen and every PG, every student will be important and effective. So with this brief introduction, let us, I welcome. So Dr. Surya sir is a little late. I will start with the IMA prayer.
Sir has logged in, sir. Sir is there, Surya.
Not login. Sir is there? Surya sir is there?
Yes.
Yes, I'm here. Yeah.
Surya sir is there?
Yes,
Sir. Please, I request Dr. Surya sir to go ahead for the IMA prayer and flag salutation.
1 minute.
Sir is the Honorary Secretary of IMA KSB.
Just 2 minutes. ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಪ್ರಾರ್ಥನೆ. ಎಲ್ಲರೂ ಸಂತೋಷವಾಗಿರಲಿ, ಎಲ್ಲರೂ ಆರೋಗ್ಯವಾಗಿರಲಿ, ಎಲ್ಲರೂ ನೋವಿನಿಂದ ಮುಕ್ತವಾಗಿರಲಿ, ಎಲ್ಲರೂ ದುಃಖದಿಂದ ಮುಕ್ತವಾಗಿರಲಿ, ಎಲ್ಲ ಆಸೆ ಆಮಿಷಗಳನ್ನು ಮೀರಿ ಗುಣಪಡಿಸುವವರು ನಾವಾಗಿರಲಿ. ಧ್ವಜವಂದನೆ. ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಸದಸ್ಯರಾದ ನಾವು ನಮ್ಮ ರಾಷ್ಟ್ರ ಧ್ವಜಕ್ಕೆ ವಂದನೆ ಸಲ್ಲಿಸಲು ಇಲ್ಲಿ ನಿಂತಿದ್ದೇವೆ. ಅದರ ಗೌರವ ಮತ್ತು ವೈಭವವೇ ನಮ್ಮ ಬೆಳಕು ಮತ್ತು ಶಕ್ತಿ, ಮತ್ತು ಅದರ ಪಥವೇ ನಮ್ಮ ಪಥವು. ಈ ರಾಷ್ಟ್ರೀಯ ಸಂಸ್ಥೆಯ ಮಾನ್ಯತೆ ಪಡೆದ ಸದಸ್ಯರಾದ ನಾವು ನಮ್ಮ ಜವಾಬ್ದಾರಿಗಳನ್ನು ಅರಿಯುವ ಮೂಲಕ ಅದಕ್ಕೆ ನಮ್ಮ ನಿಷ್ಠೆಯನ್ನು ತೋರಿಸುವ ಪ್ರತಿಜ್ಞೆ ಮಾಡುತ್ತಿದ್ದೇವೆ. ದೇಶ ಸಮೂಹಗಳ ನಡುವೆ ನಮ್ಮ ರಾಷ್ಟ್ರ ಧ್ವಜವು ಉನ್ನತ ಮಟ್ಟದಲ್ಲಿ ಹಾರಾಡುವ ಸಲುವಾಗಿ ನಮ್ಮ ಅಧಿಕಾರದಲ್ಲಿರುವ ಎಲ್ಲವನ್ನೂ ಅದಕ್ಕೆ ಸಮರ್ಪಿಸುವ ಪ್ರಮಾಣ ಮಾಡುತ್ತಿದ್ದೇವೆ. ಜೈ ಹಿಂದ್. IMA ಚಿರಾಯವಾಗಿರಲಿ. ವಂದನೆಗಳು.
and the flag celebration, sir. Now
Thank
I call upon Dr. Baslingappa and also Dr. Syed Maj to give a brief introduction about the speaker. Brief introduction of the speaker. Dr. Syed Maj, you are ready? You unmute.
Sir, I will continue.
Yeah.
Yes.
Yeah,
Good
Basling.
evening. Good evening, everyone. Just to add a note, this webinar is also streamed over the YouTube with few viewers, and it's also recorded for the further for the viewing who are not able to join now. Respected dignitaries, esteemed faculties, esteemed guests, distinguished guests, and my dear colleagues and young professionals, it is an honor and privilege to chair this academic session organized under the auspices of Indian Medical Association. I extend my sincere appreciation to Indian Medical Association President Dr. Veerbhadraya sir, Honorary Secretary Dr. Suri Raju sir, and Dr. Suresh Kagal sir for the curating this highly relevant and intellectual enriching webinar on career pathways after MBBS. As the subject itself plays a defining role in shaping not only individual careers but also the future direction of our healthcare system. It is my profound privilege to extend a warm welcome to our esteemed chief guest, Dr. Mukesh Bhatia sir, founder of Dr. Bhatia Medical Coaching Institute, New Delhi, a visionary educator and a transformative force in medical training in India. Sir, you are widely regarded as a pioneer in structured medical education, having conceptualized and institutionalized postgraduate entrance coaching at the time when such a guidance was virtually non-existent, thereby redefining how generations of doctors approach competitive medicine. Over the course of your illustrative career, you have mentored and taught more than 3 lakh medical students, if I'm not wrong, sir. And an extraordinary contribution that has not only shaped the individual success stories, but also signified influence and the academic trajectory for the fabrication of Indian medical fraternity. Your work, especially the Medicine Simplified, widely acclaimed and often regarded as modern mini Harrison, stands as a testament to our exceptional ability to simplify complex and most complex medical concepts into a clear, concise, and clinically relevant learning. Furthermore, your contribution extends beyond the national boundaries, as you have consistently mentored students for premier examinations such as NEET PG, NEET Super Specialty, MRCP, and also USMLE, thereby enabling Indian medical graduates to compete and excel on global platform. In today's rapidly evolving medical ecosystem, characterized by increasing specialization, global mobility, and other growing integration in technology into the medical education, your early vision of structured, outcome-oriented preparation stands as a benchmark excellence. The prestigious Lifetime Achievement Award conferred upon you by Delhi Medical Education is fitting recognition for your enduring contributions, leadership, and unparalleled impact in the field of medical education. Sir, your journey is not merely one of the teaching, but of shaping aspirations, building confidence, and enabling excellence at a scale which represents a larger contribution to the nation building through education. Sir, we are truly honored and privileged to have you with us today. I also extend welcome all the respected panelists who have presence add immense academic value to this session. To all the medical students, interns, and early career guide doctors joining us today, you stand a pivotal junction in your professional journey. The decisions you make today will shape not only your career, but also the future of healthcare delivery in our country. In the era where opportunities extend far beyond conventional clinical practice into public health, research, administration, policy making, and global health, the need for informed and strategic decision making has never been greater. On that note, without further delay, I invite our distinguished speaker, Dr. Mukesh Bhatia sir, to share his invaluable insights and guide our young colleagues towards meaningful and fulfilling career pathways. Sir, the floor is yours. Welcome again. Thank you for your time, sir.
Yeah. Dr.
Thank you very
Baslingappa,
much.
sorry for interruption, sir. Dr. Baslingappa, I just call upon President sir, Dr. Veerabhadra sir, to give a presidential address.
Sure, sir.
Dr. Veerabhadra sir.
Good evening, sir. Welcome, Dr. Mukesh Bhatia, sir. When I completed my MBBS, there were no coaching classes for us. We used to read from our own books and some guides were there. So nothing much was there to guide us. So you are the pioneer in this field and you have guided so many students who can get post-graduation and even undergraduation also. So you are the pioneer of coaching for students to upcome. So I am very proud of you, sir. and welcome you for this webinar, sir. Thank you, sir. Floor is for you, sir. Thank you.
Thank you, sir.
Well, thank you very much for your kind words of appreciation. So as the students, you all have been informed that today is career option after MBBS for medical graduate. But before that, I like to special thanks to Dr. Viribhadra sir, President IMA Karnataka State Branch, Dr. Surya Raju, Honorary Secretary IMA Karnataka State, and Dr. Suresh, Chairman AVA Karnataka. And of course, thanks to each and every one, senior people, students, maybe here or maybe YouTube. Now, I expect that you will have a lot of queries to ask me. I'll reply them after my session. You can post your queries in chat box. Okay, I'll take the questions together. Okay, but even after that, you still have many queries to ask because everything cannot be covered. So I'm giving you my personal number. Okay, maybe tomorrow morning you get up and you say, "Arey yaar, I want to know this thing." So I am there. JDN is there. JDN Karnataka is with you and I'm with you. So we all do a combined effort to do whatever best we can do, we will do. Always. In future also, because JDN is there to help you out. Okay, if you want, you can click this. I'll hold this slide for a few more seconds. This is my personal number. You can talk to me. I hope by now you must have clicked the photograph. So now, what are the list of the career after MBBS? So many things are there. You can go for post-graduation. Most of people do like this. But is it the only one? No, there are many more. And that's the agenda of today's talk, to guide you, to navigate you through the various path. Hospital management is a big upcoming branch. It is there, but it has a very bright scope. Study abroad after MBBS is always, especially USMLE, MRCP. Medical legal advisor, especially those who are gone into forensic medicine, they are the one. Even if you, without going to forensic, you can go to medical legal. It's again big scope. People are not aware of this branch. Researcher, yeah, it needed everywhere. You can become a writer. Public healthcare worker. Civil services, IAS, IPS. People go for UPSC exam. Many doctors are there. And I'm happy to share one thing. In the last 30 years, and whatever civil service people are there in the whole country, in whichever capacity they are, more than 70% have been my students, those who have gone into UPSC after MBBS. So it's a great happiness to see people rising to that top level. Same with you all youngster. One day you'll also go top of the world. Sport doctor, gym doctor, fitness doctor. Oh, it's a very good. You also remain fit. You keep your community also fit. And of course, you do earn a lot of money also. MBA is again a very good, especially MBA in hospital administration. Medical coordinator again is a good thing. Pharmaceutical shop and pharma dealer you can do, provided if you have a business bent of the mind. Forensic psychiatry is again another branch. Medical professor, teacher, yes. There's so many learned professors right now in this session. You can get inspiration from them to how to go to top level. And oh, influencer, it's a young thing. Recently it has come. Very good. If you are good in social media, they cannot be better than this branch. Well, there's so many things to talk. But okay. But as the time is only limited, the limited time is there. At the moment, I am left only with 20 minutes. So I cannot talk about all the 15 branches. I just enumerated it. So if any one of you want to know much more about any branch, you can directly contact me. I will be very happy to answer to your reply. Or if I get a chance in future, then I can talk about other branches, other topic, depending on the time available. But today I'll be talking about one option outside India after MBBS, that is MRCP. That I'll talk. Okay, why the reason, why not USMLE I'll talk. Well, outside country, we have MRCP, USMLE, Australian Medical Council, Gulf country, many other. USMLE at the moment when this war is going on, and you never know in what way American policy go for India. So I'm a bit doubt about this thing. But this is a very good branch. And most of you are not aware of the greatness of this branch. So I'll talk more about this thing, MRCP. Member Royal College of Physicians. What is this? It is a postgraduate degree of UK of medicine, equivalent to MD medicine degree of India, almost. Okay. Recognized by NMC, this is the most important thing. As an additional degree, it is recognized. Non-competitive, the biggest advantage is non-competitive. You just have to pass the exam. About competition or non-competition, I'll talk little later on more. Much more valuable. This is 100 rupees note, $100. What you will go? You will take 100 rupees or $100? Definitely you will take $100. Why? It is 95 times more value. Okay, this is equivalent to 9500 rupees, 9,500 rupees, definitely $100. Much more value, and moreover, this can be used all over the world. Our Indian rupees cannot be used. Same with MRCP. MRCP is recognized all over the world. Okay, MD medicine is not recognized. Moreover, suppose I have got MD medicine, you got MRCP, we both go to Gulf country, it is recognized there. So I will get a salary of 100 rupees, you will get a salary of 300 rupees. And you are preferred. So you are preferred, you get more salary also. The better is MRCP. Now, do you know MRCP 1 and 2 are online exam? You need not go to UK. You can do MRCP soon after completing your internship. Very, very important point. I think this line is the most important for every member of JDN. All JDN members are usually intern or post-intern. Okay, so you all have done internship or doing internship. You can write this exam. Only requirement is internship. Now, I will elaborate more on this point. Suppose, suppose you or anybody is an undergraduate. Second year, third year, you start preparing for MRCP. Or those who are interns now, you start preparing. The moment you finish your internship, you can write MRCP. That means after passing internship, you are getting MBBS degree in one hand. In the other hand, you are getting MD also, that is MRCP. Once you do MRCP, you can fly to UK and you are 3 years ahead of your peer group, which most of students are not aware of. No entrance exam. This is the biggest disadvantage of Indian exam. I'll talk more about this. It is not a competitive exam, musical chair. In India, there are so many people compete for few seats. I'll talk more. It is just a passing exam, no entrance exam. Now let me explain to you. Like in India, you can see there are 1, 2, 3, 4, 5 seats. These are reserved to one reason or other. Open seat is only one. And moreover, 2.5 lakh students are competing to write this. There's only one seat and there are 100 people are competing. 1:100 is the ratio. If you want to get MD in a good college. Okay, 100 people, 100 good students are competing for one seat. One will get, 99 will not get. Are they not good students? They are also equally good students, but they did not get it because of so-called competitive exam. In contrast, this is MRCP. All seats are open. All seats are open. You just have to pass the exam. So passing is depending on you. But when we talk about competitive exam, you should know more than what others know. I repeat again, in competitive exam, you should know more than what others know. But in passing exam, you have to fight with yourself to clear the exam. Okay, so MRCP, all seat open. Brilliant 5 students compete, they all get no competition. I hope you understood the meaning of game of musical care. Now, this exam is held 4 times, 3 to 4 times a year. No need to wait for 1 year like Indian PG exam. If you are not able to clear once, then again for NEET PG you have to fully wait for 1 year. But here we have four times a year. Write your exam in your own city or country. Say country because many people must be watching from outside India. So you can write your own country to see the centers. You can open the Google and check your city and center. Now, once you're done MRCP, you go to UK, you work, and you can do super specialty also in any branch in UK without any entrance exam. And once you're done super specialty, you come back to India, then you can join any big corporate or group like Apollo, Medanta, Fortis, Narayana, and senior consultant. Salary in India after MD is 7 to 8 lakhs. In contrast, in UK, 7 to 8,000 pounds. And £1 is how much you know. It is in Indian rupees, it's around 70 to 80 lakhs per annum. I repeat again, 70 to 80 lakh. That means almost 10 times, 8 to 10 times what we get in India. Moreover, you have to work only 48 hours a week, not like our country, you keep on working for 60, 70 hours, but you work for 49th hour, you get double salary. The Indian people being a very hardworking, they work on Saturdays, Sundays, Christmas holidays. So overall, the Indian people earn around more than 1 crore rupees per year. And okay, this much earning is there. We can't think of this much amount of money. And there's no bond of work. This again a big advantage. Not like India, you first join and they this bond, you have to work for this many years, blah, 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 nothing. You are free. Standard and work, do I need to tell you this is the standard of the work? This is the of UK. Do I need to tell the difference? No way. This one slide is self-explanatory regarding standard and work culture, slightly different in India and UK. Okay, I think they're dream car for everyone. Now, what's the eligibility criteria? Who is eligible? Internship completion from any medical college in the world recognized by World Medical Council. While I presume most of you are watching in India, and okay, all the colleges are almost recognized. However, any remote area or any remote college you want to confirm, you can go to the Directory of World Medical Council. This is available in Google. You can check it. Okay, those out of India, you can check your college. So if you are done and you have done internship, okay. Now, if you open the Royal College Physician site, what he writes, very confusing line. 1 year of postgraduate training. That postgraduate training means equivalent to internship. What they say today, this is the final year. You do internship for 1 year. This is what's called 1 year of postgraduate. That means after graduation, you work for 1 year, that is internship. It is really, really confusing line. Even when I came to read about this line, I had a doubt. So I got clarified from Royal College of Physicians. What does it mean? And fortunately, and they are very prompt in replying. I got her answer within 24 hours that you should have a valid internship of 12 months. I hope you are clear about it. Now, who should prepare and write this exam? Especially this slide is meant for keeping in mind about member of JDN. UG and student who will be, of course, they will become member of JDN very fast, and interns. You study, your study will greatly help in your now. Suppose some undergraduate student is there. It will help in university exam also, NEET, PG, and INICT. And moreover, you are getting MBBS and MD at one time together. I explained to you. You write this exam soon after internship, you can get MBBS degree in one hand, MD degree in other hand. Now, those who are DNB or diploma in family medicine, this is very, very important for JDN members. Diploma in doing DNB or diploma in family medicine. Well, family medicine people cannot become specialists or super specialist in particular. Okay, but you keep on doing your family medicine. Simultaneously, you prepare for MRCP. MRCP study will help you in your family medicine exam. And later on, you go to UK, you can become super specialty, cardiologist, neurologist, nephro, dermatologist, whatever you want, including dermatologist also. Well, now all FMG students, this again a big chunk of JDN students. Now, if you have done internship, I presume you have passed your FMG exam. You've done internship or doing internship. Okay. You can write exam after internship, of course. Okay. Now, if I have to add on a few more lines about FMG, I have met so many FMG, I have taught so many FMG students. I have been to China also, Russia also. My personal perception about these students, they are all again very brilliant. They are hardworking. They want to learn also. But when they come to India, when they write INI, CT or NEET PG, they find difficulty. Why? Because the teaching, what they were taught in their native country, China, Russia, or whatever you talk, their teaching is entirely different from what it is taught here. Their exam is totally different from our exam. So they are unfit for this exam. I have used unfit because they find difficulty, because they are not tuned to. They are not tuned to this type of exams. Okay. Well, it is just like if we get a polar bear who always lives in the ice, snow, and you bring him to Delhi or Chennai, who's so hot, they will not be able to comfortable. Why? The environment is different. They will have difficulty in surviving. Same thing. I hope you got the idea that FMG student, why they find difficulty for NEET. For them, it's a beautiful line for MRCP. So all post intern get your deem branch. Suppose all post intern, there are many people who are writing exam for many years. I know many people who have been struggling for last 5-7 years. They miss their MD medicine. They want MD medicine, but they are not able to get it. Now you should go for, okay, you should go for MRCP. Again, not a competitive exam. You can become super specialist. I think it's the best thing for post intern who want MD medicine. All those who are MD in any pre or paraclinical subject. Suppose there is one fellow who is doing MD in biochemistry or physiology, but his dream branch was always medicine. But he could not get MD medicine after 2 or 3 trials. Finally, he takes a branch, maybe anatomy, physio, biochem, whatever they want, they get it. They take it not because they want it, but there's no other option. You can very well do it. You continue with your whatever current job or MD you are doing, you continue. You can simultaneously prepare it for MRCP, what to do, how to do this. Itself is a big topic. I'll be definitely guiding you. I have given you the number, or if I get another chance to speak in the JDN platform, I'll be very happy to talk on that. But that again needs a lot of time. But of course, time has a limitation. But in the meantime, anybody has any personal queries, I already given my number. I'll share your number to you. Now there are so many queries which usually I get it. Let me discuss. When should I, one very commonly asked question, when should I start preparing for MRCP Part 1? Answer from today. Whichever, if you are undergraduate, start preparing for right now, or intern, post-intern from today, tomorrow never comes. Second, what an ideal strategy to start MRCP preparation from scratch? Well, like we have a MRCP course. It should always, your basic concept should be very, very clear. If your basics are not clear, then international exam like MRCP, USMLE, you can never crack with the good marks. To start your basic concept very, very strong, they want clinical integration. How should working doctor manage preparation for with limited time? It's a beautiful, very frequently asked question. Well, My answer to this, normally duties start around 9 o'clock to 5 or 6 or 7, whatever you want. So the best time to study is early morning. Maybe 1 or 2 hours. What I say, you study one topic, okay, and you make a small note. And when you are in the working during duty times, during lunch time, breakfast, tea time, you start teaching your colleague or junior. Because teaching is the best way of remembering. Teaching, teach, keep on speaking, keep on speaking. Rule of 7. Every topic you speak 7 times. There are many other memory technique also, which I have designed. It's a, okay, what's that technique? In good olden days, in Gurukul, students used to go to study. There were no books, no libraries, no computer, no chat GPT, but they still you could remember thousands of things. The technique was there. So when I talk about that technique, I have inculcated that technique, and I also added on to modern Japanese technique of time management. And that two combination gives a beautiful way to success. Again, time is short. I cannot talk much more, but I have briefly given to you. But anybody interested, I will definitely like to discuss that also. But okay. Now, what is the best revision strategy to clear MRCP in first attempt? Again, to the technique what I was talking in the previous slide. That is the best way you remember, think forever. And moreover, for everything you should make some beautiful quick recall questions should be there, which we always give to students. And if you know that much, you are a topper of MRCP. You should not pass the exam of MRCP. You should top in the MRCP. Remember, you have joined the platform of JDN, and JDN is there to support you in all the possible way. I'm also a part of JDN only. So how many months of preparation are realistic required? This is a variable. It all depends how many hours a day you can study. It also depends on how much you know, whether you are undergraduate, you are doing, or you have done MD. There's so many things, but you need sufficient time. It's not an easy exam. Okay, you need sufficient time depending on person to person, but by and large, you need 1 to 2 years, again, depending on you are in which year. Can MRCP clear within 2 to 3 months of focus study? No way. No way. It's not an easy exam. Okay, it's not an easy exam. If you have not done MD medicine, then it is not a, this cannot be done 2 to 3 months of focus. No, sir, you trained us. No way. Because do not forget, the examination fees is around 80 to 90,000 rupees. You fill the form, for 90,000 rupees, you do not pass, the 90,000 goes waste. In the next time, again, you have to pay the same amount. Money is very important because we Indians have very hard-earned money. So do not waste if you are not well prepared. Which question bank is better, or past medicine, past is a very commonly asked question. I say don't read these question bank. First, your basic concept should be very clear. For example, you take any one of them. There's a question on acid-base disturbance, but you don't know what is the basic of acid-base disturbance. You cannot mug up and pass this exam. The blundermost mistake made by the most of students, they just say, "Arey, senior says read this and you will pass MRCP." I say, I am senior to your seniors also, definitely. Okay, so your senior are much junior to me. Very obvious. So remember, your basic concept should be very, very clear. Okay, I hope you understood my point. How should one balance question bank practice with theory and notes? As I told you, first need the theory, basic concept. Like suppose you have read you know about the basic concept about acid-base disturbance. Then you should do the question bank, but not other way around. Okay, without only question bank, success is never there. Which subject are high yield for MRCP exam? We say it's a medicine. So 80 to 90% is medicine. Even they ask anatomy is based on medicine. Physiology is based on medicine. Pharma based on medicine. Biochemistry based on medicine. Everything is related to medicine only. What makes Dr. Bhatia Academy MRCP program different? Well, we do training for MRCP because we are the one, we do part 1, part 2, part 3 at one place. Nobody else in the world doing it. So we are there. And I promise you, anybody in JDN, I can do the best for you at every level. I love JDN. JDN is doing wonderful thing for you. You should be all this message to all the youngsters. You can't believe that how much senior people sitting in IMA and JDN, they are concerned about you. They are definitely always taking pains to do the best for you. Everything is discussed with the top management, with Dr. Ketan Desai sir, and people in the IMA headquarters, people sitting in JDN. Everybody is concerned about you because they think that they love you. There cannot be better thing than that. Senior people sitting at the IMA level, they are so concerned about you. So as I told you, everything is there for you to get it. Can MRCP pursue after MBBS, and what the pathway? As I told you, you do MBBS, you prepare for MRCP, go to UK, the point I discussed. It's better to do MRCP after MBBS or after MD. I think if you can do after MBBS, is far better because then you save. You may not do MD medicine, you can straight away fly to UK. But if you are doing MD, don't leave that. I repeat my statement. If you are doing in MD or DNB in any branch, do not leave it. Start preparing simultaneously. And by the time you write your MRCP, you already have done your MD, DNB, but don't leave in between. But a career opportunity after MRCP India, yeah, I told you it's recognized all over the world. It is recognized by NMC also as an additional degree. All corporate hospitals, they prefer to have MRCP people to work with them. Why? When you go to UK, you learn the latest technique, protocols you learn. And Indians are very hardworking. Okay, so they prefer Indians with MRCP because they learn the latest technique from them. And inherently, we are very hardworking. So they get the best brain with the best hardworking. So remember, you are recognized all over the world. Well, can doctor work in GCC or abroad after MRCP without UK experience? Well, again, this question asked to me. Once you have done MRCP, your work experience is essential. Your work experience is essential. But okay, without work experience, just having a core degree of MRCP carries no meaning. You have a degree in your hand, but experience is not there. Working experience is needed. Is MRCP worth at this stage of my career? Oh, you can do anything. There is no age bar. As long as your heart is young, your brain want to progress, you can write. Even at the age of 70 years, okay, you can write. Be young at heart. Okay. Be romantic. Yes, you be romantic. Be lively. Create dopamine all the time. And that will increase the energy level and the lifespan also. So this is what all I wanted to discuss with you. Okay, well, briefly, one question is always asked to me, how we teach for the MRCP. We have 3-round strategy, basic concept, test and discussion, and mock test. This I'll not discuss much in detail. This is not the domain, but I just want to tell you how you should study. Basic concept, why I've kept this slide deliberately to emphasize again and again. Your basic concept should be very, very clear. Then you do question bank and mock tests. Well, if you then My personal number is there. You can click it over. If you want any guidance, rather what I say, all the students who are watching this or now or later on, you can send a hello to me and saying that we joined JDN webinar. And don't forget to write your name, college, and what you are doing, which year you are. And I told you in the very beginning, I cannot cover everything in this session of few minutes only. But again, I try to cover at least one topic in detail, which gives satisfaction to you also and to me also that I have done something good for the student community. So before I say thank you to all the audience and to the organizing team, if you have any question to ask, oh, there are many questions there in the chat box. Okay, so let me go through the question. Okay. So the first question, sir,
Yeah.
how important is passion versus practicality when choosing a branch? Very good question. I think I give it passion. If you love something, do that thing what you love it. This question has been asked to me by Kanis Fatima. Yes, Kanis, I asked you one question. Okay, suppose you like something. Suppose you like a dish, maybe butter chicken. And one thing you don't like at all is maybe kaddu, tinda. You go home, you say, Mom, what have you made? Mom say, oh, I made butter chicken. Oh, I'm very hungry. Bring. Normally you take one bowl of rice. That day you'll take 2 bowls of rice because you love that thing. And suppose mom say, no, I have made tinda tori. Oh, mom, I do not feel hungry. I've already taken something in the canteen. What happened? It was the passion. You like something, do what you like it. Do what like, but do with a full heartedness. I'm a can you believe it? I'm a practicing physician, but I enjoy teaching. I love teaching. I read a lot. I'm a voracious leader. I attend all the conferences like a student till date also. And most of the time now my students are speaking in the conferences. Those of my earlier batches, they feel surprised, started sitting, making notes. Because I learn. I'm a student of medicine. You should be a student of medicine. Always learning. When I listen, speaker prepare the notes very nicely. Whatever extra point I get it, I put in my notes. And the very next day, they are in my lecture also. So practicality is different. Practicality is very easy. Start general practice. You start earning money. No. Do जो दिल की चाहत हो वो करो. Do what your heart says. The next question is from Abhishek Patil. Sir, how should be an MBBS student decide which branch to choose after MBBS? It's all a matter of own choice, but it's a personalized question. So you can talk to me after the session or you can leave a message. I'll reply you. But however, it all depends on matter of taste. I always wanted to do medicine and I did it. Okay. Rather, if you really want to know about me much more than how much struggle I have done it, you can see my podcast in note down the Nachiket Bhatia show. The Nachiket Bhatia show, the beautiful podcast. I've told my whole story, how I struggled, how I work. At one time, I used to work morning, evening, night to survive. Okay, it's a beautiful story. Do it. Otherwise, you can. I've given my number. You can send a message. I'll send you the link also. So now, next question: how should an MBBS student decide? Acha ho gaya hai. Okay, is it better now? The question is from Ananya Prakash. Is it better to take a drop year? Drop year? Equin. It's better to take a drop year for a better rank or join a branch and move forward. Very difficult question. This question is asked to me by almost everyone. If I were there, I will take a drop. Then, but that drop year should be utilized only for studies, what to do, how to do, that I'll guide you. How to study, that I'll guide you. Rather, I'll request all the JDN organizing team members that they should keep my lecture, how to study to top in any exam. I have a beautiful lecture. I have taken this in hundreds of places, including IIM, Ahmedabad also, IES, C Institute I have taken. I'll be too happy to take at the bigger platform. So I hope you got my answer. But again, it's all depend person to person. Then there's one more very long question from Dr. Shravani. Hi, Dr. Bhatia. I have been followed Bhatia Medical Coaching. I am an FMG from Talispi. I went 2 years back to Talispi State. I am preparing for NEET PG as well as some USMLE exam. Currently preparing for step 3, working for residency application in the US. My question, what to do you think is the biggest mistake in application make them pursuing opportunity abroad, and then should be focus our effort to strengthen our application, be USMLE or MRCP? Oh, you ask a very big essay type question. So this is a very long question. Limited time is there.
Yes,
so I'll request you, you have noted down my number. You send this question to me, then we will have one-to-one chat for 10-20 minutes to answer your question, because I don't want to waste the time of others. And many of the senior people are too busy in their work, but they are just sitting and listening to me. There's one question from Weber. How should students manage stress and burnout during preparation? Yes, I told you, I have a beautiful lecture about this only. How to study to top in an exam. Suppose I ask you, all of you who are listening to me, how many hours a day you should study to top in any exam? So people say 10 hours, 12 hours, 14 hours, 15 hours. I say 1 hour. 1 hour per day? 1 ghanta. Sir, are you joking? I say, no, it's not a joke. It's true. I have guided so many people. Friends, there's no shortcut to hard work. But hard work should be done in a smart way. Smart work is more important than hard work. This is my forte of discussion. Okay, so this you got to answer. Then I think it's the last question. No, there's no more question. So if there's no more question, then I hand over. Again, I thanks again to all the organizing members, other senior member, panelists, and all my young friends. I always say young friends. Okay, you're all my young friends. Entire JDN team is there to help you out in the best possible way. If I can do something good at my personal level, I will be too happy. So I'm also part of JDN. I have repeatedly said it. So we all want you to do the best in your career. And we are always, each one of us is there to help you out in the best possible way. Giving the personal number itself indicate that we really want to solve your problem. We want to finish your queries. Even tomorrow also you have query, I'm always there to help you out. So I pass on to Dr. Suresh. Please, stage is yours. Thank you very much once again to all of you. I hope it was useful. Please do give the feedback. All the young students, you please do the give to feedback to me and tell the testimonial how it was, and so that we also know how we have done it. Thank you very much. All the best. Dr. Suresh, please.
Yes, sir. Thank you very much, sir. Very elaborate and very interesting. And you have taken us so much duration in such a way that as if we are learning, as if you have taken some coaching class. So very enlightened and a lot of things we have learned, sir, especially rule of 7. Sir, what is the rule of 7, sir, for a student? Hello? Yes, sir. Yes, sir. Yeah. Anybody want to ask questions? Dr. Syed Maz, anybody want to ask questions?
Dr. Bhatia, sir, hello.
Yeah,
please. Go ahead.
Please tell me.
Sir, there's a echo. I think. Now.
Dr. Syed, you are not audible, please.
Parvinder Singh, can you unmute?
Put, I think it's not audible. You can put questions in chat box.
Dr. Syed.
Now audible,
Sir?
sir. Please check.
Yeah. Dr. Syed, please.
Mukesh sir, Bhatia sir. Hello sir.
Yeah.
Yeah. So,
One second, sir.
yeah, you can put.
You're audible, sir. You're audible. Say it, sir, please.
Remove the earphones and speak.
Yeah, madam. Anuradha, madam.
Yeah, let him remove his earphones, then we will be able to hear him.
Okay. Anuradha, madam, please ask questions, sir, madam. Anything you want to ask questions?
Yeah, no
But-
questions. I'm really impressed with the excellent supportive attitude that Dr. Bhatia has for all our youngsters. Well, sir, we are all committed to our growth of our youngsters. So anything and everything our youngsters, our budding doctors want, we are always there to support them. And that came out from your mouth also. I'm extremely happy about it. And thanks for the good suggestions. Well, you spoke only about studies abroad in England. Probably Dr. Suresh, we could organize another session where sir could highlight or we could get good highlights on other fields also, be it IAS, IPS, or it could be hospital board management, or it could be community medicine, getting into becoming a WHO consultant. We have lots and lots of scope, and our youngsters need to know that they need not have to focus only on one aspect. Sir, with respect to the field that you chose with respect to today's topic, well, you have covered adequately, and I appreciate your support for our doctors. Thank you, sir.
Always there. I'm always there. Long live IMA, long live JDN. Thank you very much.
Thank you very much, sir. Thank you very much, sir.
Thank you, sir.
Yeah. Basalingappa, sir.
So, Dr. Suresh, only request to Dr. Bhatia sir is any doctor he comes across, let him make sure that they fill the IMA membership form and become part of Indian Medical Association.
I have been doing it.
Thank you, sir.
Okay.
Thank you.
Yes, sir. Please, sir, encourage, sir. All the members who are approaching, please encourage them to make a registration. IMA membership.
101%, sir. I have been doing this thing. I always say.
And also,
sir,
yes, also, sir, we have our headquarters IMA building coming up after demolishing the old one, and we are welcoming funds also for that. So, from your side also, we need support.
Sure. And moreover, I think ICP is organizing quiz, and Dr. Suresh has been in charge. So I'll be coming to your place also soon. Dr. Suresh, you have to give me the date for the ICP quiz. Okay. Thank you very much. So I think we close the session. Okay. Thank you very much.
Thanks, is there, sir?
Dr. Syed, please.
Yes, sir. Please.
Bhatia sir. Hello sir. Yes, sir. One last question I got it from the intern, sir. At the current scenario where there are so many online platforms, offline platforms, what is the role of standard textbooks? I think the new generation of doctors, they are moving away from the standard textbooks. What do you want to recommend for that?
This is a very good question. The biggest mistake of the students. First of all, reading only books carry no meaning. If reading only you can pass an exam, then what the use of any college or schools? Am I right? For example, okay, let's talk about you are there and your junior comes, sir, I want to learn cardiac cycle. You say, okay, sit with me and you will teach cardiac cycle only in 10 minutes. He says, no, I will read myself. He will take hours, days together. He cannot finish cardiac cycle. So that's why proper learning is essential. From a teacher, guide them. That's a purpose. I could talk to you about 40 minutes only. I could tell you the whole thing about MRCP, which student cannot learn even after trying themselves for so many times. Okay. So any other question you want to ask me?
Sir,
So
one
one more
question,
thing,
sir.
yes, sir.
Yeah, please go ahead.
The UGs were asking me about the importance and the technique of revision, sir, not just for this PG examinations. The importance of if you make any video on YouTube, it will be very, very better, helpful for that.
Definitely, I told you because I have a full lecture. I can talk on one full lecture, beautiful lecture. Okay. Otherwise, anybody else want to ask, they can ask me. Definitely, I'll guide them. But I'll request rather the JDN, the country wise, they organize a conference, this session. I'll talk to them how to study to remember things. But definitely, what I at the moment because that session may happen after many days or weeks. In the meantime, what to do? I have given you my number. You send a hello to me. I'll send you one video and some question. And then you find, array, it is such a simple way of studies. After you watch that video, okay, then I'll tell you what is the right technique of studies. My number is still being shown in the screen. Send a hello to me with name and all the things you college you are, which year you are. I'll answer to your question. How to remember. These are called rule of 7. That I'll explain to you.
As you said, sir, smart way of hard work. So I think this
Yeah.
could be a smart way of hard work.
Smart work is more important than hard work.
Yeah. Thank you.
So I
Yes,
think it's a pleasure
thank you,
talking
sir.
to you, all of you. Any other question? Sir, you can close the session now.
Yeah.
Sir, I request Dr. Syed to produce vote of thanks, please.
Thank you, Bhatia, sir. Thank you, sir. That was a truly insightful and thought-provoking session. On behalf of everyone present here, I'd like to express our sincere gratitude to Bhatia, sir, for taking the time to guide us through one of the most important decisions in doctor's journey, what to do after MBBS. Today's session was not just about listing options, but it also brought us a clarity to the confusion. Bhatia, sir, also told about not just the PG pathways in India, but also the opportunities abroad like MRCP and USMLE. On a personal note, sir, as someone who has learned from your lectures during my preparation, I can personally relate to the clarity. I myself was your student during my UG days and my PG preparation days. I've been a student since my third year MBBS. One of the reasons I got interest and passion in general medicine was your way of presentation, sir. That was one of the reasons why I took general medicine as my career option. So it was truly an honor and privilege to share the stage with you. I'm sure that this session has helped many of us move from uncertainty to one direction. I would also like to thank the organizing team, the IMA Karnataka branch, the JDN, the JDA, the Junior Doctor Association, Dr. Suresh sir, and everyone for conducting this highly relevant webinar, and all the participants for the active presence. With this, I come to the end of today's session. Thank you, everyone. Have a great evening. I hand over to Dr. Suresh sir for further questions.
Thank you, sir. We'll wind up and thank you, John. You have made a good coordination. Thank you, everyone, once again. Thank you, all the PG students, internees, and also viewers, YouTube viewers. I once again thanks to our Dr. Mukesh Bhatia, who is a founder of the Bhatia Institute, which has spread all over the country. And sir, we are proud of you, sir. Thank you, sir. Thank you and good night, everyone. We'll see you in the next month with a different topic in the webinar. Thank you. Thank you, Anuradha
Thank you,
madam.
sir. Thank you once again.
Thank you.